Hi guys, this is Sherry Miller Jolly with Dental Support Essentials, and I want to talk to you guys today about claim services. So as you all know, if you're going to send electronic claims, you have to get an electronic claim service, and it isn't automatically a part of your software. Sometimes you have to include it in a bundle. I know many of the major software companies offer their own claim service, but it is an extra charge and usually a monthly charge. Many times you charge per claim. So I want to talk to you about what happens when you change a claim service. One of the main reasons people change claim services is due to cost. Most claim services charge you by the claim, but there are a couple out there that don't charge for the claim. They just charge a flat rate per month. So that's usually the biggest reason why. A lot of people do change claim services though because of the results they might be getting when they go to research unpaid claims. They'll find that there's a little bit of difficulty or some disconnects when they're tracking an unpaid claim, or if they can't, the most common difficulty is getting an attachment tracked. Using NEA, finding out where that NEA number is depending on the software that you're using. I have found that when you pay for the higher priced claim software that they don't seem to be superior to the lower price claim software. So if you're out there shopping, take a look at those. But in my experience, I don't see them being superior in any way. But if you do change claim services, there is a couple of things you need to know. The first thing is that when you change a claim service, you may be changing a clearinghouse. And that means your practice may need to be re-registered with certain plans through a new clearinghouse, particularly if you participate in Medicaid. If you are sending electronic claims through Medicaid, you may have to send a new registration that notes your new clearinghouse to that Medicaid plan. And sometimes that registration can take a week or longer. Sometimes it can take 2 weeks, but it's not something that you want to find out after your claims have been over 30 or 60 days. It's a question you're going to need to ask before you get started so you can submit that registration right away. Another thing that you want to double check is the payer IDs. Sometimes the payer ID is different. And so each claim service should provide you with a list or make available for you to download every participating plan and their payer IDs. So that would be very simple. You just look in your software and see which payer IDs are attached to the companies, and then you just look at your list and make sure they're the same. Many times they are. Occasionally you'll find that they're not. I find it sometimes with Dentrix. When you're switching from the Dentrix software to an outside claim software, you'll see a change in payer IDs. Another thing that you want to pay attention to is if you're using an outside, and when I mean by outside, if you're not using the claim service that's offered by your software company, you're using a third party, you need to pay attention to what happens when you do upgrades to or updates new versions of your software, particularly if you're upgrading to EagleSoft 20. If you're using an outside claim service, you do need to do some updates on your claim service, and you need to contact your claim service, or you'll find out that your claims have suddenly been interrupted and they aren't going through. So those are some things to look for, and so things to be aware of if you're shopping for a claim service or you're currently using an outside claim service. I hope this helped you. I hope you have a great day, and check us out on dentalsupportessentials.com. Thank you.